I've always had interest outside of medicine. I started doing a lot of more serious bird watching. On Wednesday mornings, I'm typically out tromping around in the fields looking for a yellow-bellied sapsucker or something like that. It's like this other part of my brain has come alive.
During her more than 30-year career as an international leader in infectious diseases, the medical part of Hamilton's brain was squarely focused on tuberculosis associated with HIV/AIDS.
I came to Duke, did my residency, and then as a fellow, asked Dr. Joe Greenfield if I could explore the possibility of doing international health. So I went to Tanzania thinking I was going to study all sorts of tropical diseases, but when I got there and I saw everyone was dying of AIDS, and when I say dying of AIDS, they were dying of tuberculosis. So it became clear to me that that was the critical problem of the day.
When she came back to Duke from Tanzania and indicated that she wanted to focus on tuberculosis research, there was no longer a designated TB program in place. So she started one.
So I was able to create my own program and get an NIH TB academic award, which allowed me to then start getting my own mentees and training them up. I'd say my body of work doing clinical trials research with the CDC-funded TB Trials Consortium was one of my greatest accomplishments.
In 2011, she was a lead author of a New England Journal of Medicine paper showing that using just 2 drugs once a week for 12 weeks was just as effective as a more rigorous 9-month regimen.
This is a deadly disease, and so we've been able to make real improvements.
She has been honored with numerous awards, including from the China Tuberculosis Hospital Association and the Robert Koch Award.
The Robert Koch Award is one of my most prized awards. Robert Koch was the individual who in the later 1800s identified the Mycobacterium tuberculosis as the cause of the disease that everybody knew as consumption or tuberculosis.
Hamilton is married to John Hamilton, a Duke infectious disease emeritus professor. They have a blended family of 4 children and 3 grandchildren. In addition to bird watching, Hamilton stays active gardening, cooking, fly fishing with her husband, and continuing to mentor infectious disease residents at Duke.
Duke has been important because I had the opportunity to work with people who were passionate about what they did, and I really learned about leadership by watching some of the great leaders, how they figure out how to help their people progress along that pathway.